We're going to tell you about vocal hygiene for teachers. This presentation is done by Jill Harland, Keely Hamblin, and Misha O'Donnell. Teachers are required to speak for several hours each day, and often in noisy and poorly soundproofed environments. Teachers represent the highest volume and highest risk occupation for voice disorders, and therefore vocal hygiene is important.
What is vocal hygiene? It's a program of vocal health usually introduced in voice therapy that uses strategies to preserve vocal fold tissue and vibratory characteristics of the vocal folds. Vocal misuse is abnormal vocal behaviors that cause stress or injury to the vocal folds. An example is excess tension while speaking. And vocal overuse is normal voice behaviors that takes its toll with time. For this one, an example would be a singer after many years of performing.
What is a voice disorder? American Speech and Hearing Association states that a voice disorder occurs when voice quality, pitch, and loudness differ or are inappropriate for an individual's age, gender, cultural background, or geographic location. A voice disorder is present when an individual expresses concern about having an abnormal voice that does not meet daily needs, even if others do not perceive it as different or deviant. In the United States, the prevalence of voice disorders among teachers is 12%, compared with the 6% occurrence found in the general population. What would a voice disorder sound like? Their voice may sound rough, which means that it sounds harsh and gravelly. Their voice may be breathy, which means it sounds like excessive air is escaping while they are speaking. Their voice may have a strained quality, where the speaker has a lot of tension and effort when speaking. Their voice may be abnormal pitched, which means the speaker's voice may sound too high or too low for their age and gender. There may be abnormal loudness or quietness, which means it's too loud or quiet. It may be aphonic, which means they have lost their voice completely. There may be voice breaks, which means there's short breaks in the speech. This will be demonstrated in an upcoming video. Or they may have a hoarse voice, where the voice sounds rough and breathy at the same time.
Causes of voice disorders for teachers can include throat clearing, caffeine and smoking cigarettes, loud talking, sleep deprivation, dehydration, and consistent talking. These can all cause damage to the vocal folds and impact vocal health. And this next slide will show a video that demonstrates some examples of the causes of voice disorders.
We're going to show you some scenarios of what you shouldn't do while you're teaching, and then give you some tips about what you should do when you're teaching. Now, don't do this.
Hi class! Today we're learning about math!
Instead of throat clearing, maybe she should try this.
Hi class! Today we're learning social studies.
Now, don't do this.
Class! Today we're learning math!
Instead of yelling, maybe she should try talking like this.
Hi class, today we get to learn about voice disorders.
Now, don't do this.
Coffee.
She's drinking a lot of coffee. Maybe she should pair it with some water. If you need to seek professional help from a speech-language pathologist, these are some of the treatment strategies that could be used. Vocal function exercises strengthen and rebalance the systems involved in voice production through a program of systematic exercises. Resident voice therapy involves training the teacher with a voice disorder to either use the voice in a manner that is less traumatic to vocal fold tissue and or to systematically exercise the voice to protect it from the demands of teaching. Relaxation and breathing strategies. So since breath control is an important aspect of voice production, these breath exercises are designed to help to learn to breathe deeply with ease and comfort and to capitalize on the body's natural ability to breathe with reduced tension. A relaxation technique which is taught in therapy is called a circumlaryngeal massage. This massage is the larynx to reduce the tension in the muscles. Here is a video demonstrating a circumlaryngeal massage.
Hi, I'm the teacher from the previous clip, and my throat is really sore from excessive throat clearing while teaching.
I'm Keely, and I'm the SLP. I'll show you a strategy that can help to release the tension in your muscles. It's called a circumlaryngeal massage.
That feels much better. I'll try that at home.
Teachers should use prevention strategies to avoid voice disorders and to practice proper vocal hygiene. They should avoid yelling by using other methods to get students' attention, such as clapping, raising their hand, or turning the lights on and off. They should also stay hydrated. They should drink small sips of water throughout the entire day.
Some other prevention tips include resting your voice. When you can, give your voice breaks. And also avoiding whispering, because that can cause damage to the vocal folds. And another option for a teacher is to use a frequency modulation amplification system. And what they do is amplify sound in the classroom, so they can prevent the teacher from yelling, and they can use their voice and speak at a normal level. The sound is amplified so the students can hear the teacher more clearly. In a study conducted by Roy et al., the effectiveness of the Chatterbox portable voice amplification system was examined, and results indicated that the amplification device reduced the speaker's vocal intensity level and increased the intensity of the voice at the back of the classroom.
Here are some talking tips. Some medications lead to dehydration of the vocal folds, so be aware of the medication you are taking, and if they are dehydrating your vocal folds, you could see if there's an alternate medication, or be sure to pair it with lots of water. Repeatedly clearing the throat or coughing may irritate vocal fold tissues. Frequent heartburn and sour taste may mean stomach acids are spilling over into your larynx, which may lead to voice problems. And smoking is the leading cause of laryngeal cancer.
Speaking loudly or over long periods of time may lead to a voice disorder. Hoarseness or breathiness may signal a voice disorder. Stress can lead to forceful voice production, resulting in possible tissue damage. Caffeine and alcohol dehydrate the vocal folds, which can make it more difficult to keep them vibrating when speaking.
There can be negative impacts on teachers who have voice disorders. It can interfere with their job satisfaction. 18% of teachers miss work due to vocal disorders, and 40% of them may limit their classroom activities due to a voice disorder. It can also, they also might have to consider a career change. It can cause laryngeal discomfort. They may have to increase their effort during voice use. It can lead to vocal fatigue, and they may have difficulty projecting the voice to the back of the classroom. And of course, it can ultimately lead to voice disorders.
Impacts on the students. Students' learning suffers when they cannot hear or understand their teachers. Students might get distracted by the quality of the teacher's voice, and students might act out if they do not hear the instructions. This video shows some different types of voice disorders and the students' reactions.
Now we're going to show you a teacher with different types of voice disorders. This is Mrs. Hamlin, and the first type she's going to show us is a voice disorder with voice breaks.
Okay, class, go get your pencil cases.
Mrs. Hamlin, I can't hear you.
And now the next type she's going to use is breathy voice.
Okay, class, go get your pencil cases.
What are you trying to say?
And now the next type is a quiet voice.
Okay, class, go get your pencil cases.
Can you repeat that? I don't know what you're saying. Here are some resources for teachers or anybody looking for more information on vocal hygiene.
Here is our reference page. Thank you for listening.